I intend to eliminate hepatitis C in Northern California. Not by myself, of course, but with a whole army of HCV spokes. The time is right. We have all the tools to do it. Diagnosis is simple, treatment is easy, effective, and those that are cured, their life is changed forever. They no longer have that monkey on their back. They're not waiting for the other shoe to drop, their liver disease to manifest, the development of liver cancer. We can take all of that away. And so I have this sense that we need to eliminate, and we need to do it quickly. I have this kind of sense of urgency about it. And ECHO provides for me the mechanism to do elimination, but to do it in this rapid fashion. Why is there such urgency? Well, we know that many of the individuals, both in California, in the US, were infected with hepatitis C decades ago. And for 20, 30, 40, 50 years, the hepatitis C virus has been slowly but relentlessly damaging their liver. And now, after decades of that abuse from the virus, their livers are now really at risk for having cirrhosis or liver cancer, and we need to get to them before that happens. So we can't wait 5 more years or 10 more years. We need to find them now. We need to get them the treatment they need before it's too late. And then we have the other new crisis, the other urgent need, and that really is reflected in the new infections we're seeing in younger individuals. Fueled by the epidemic of opioid use, we are now in California and in many other states seeing individuals presenting in their 20s and 30s, not only with substance abuse disorders, but more importantly, hepatitis C. They're both getting and giving hepatitis C. And so if we're going to transform the picture in California, if we're going to get elimination, we have to think about finding all of those that have been infected for decades, and we need to also go into those populations that are getting their infections today. Now, I'm kind of new to ECHO, actually. I only started our ECHO program in November of 2015. I've been a huge fan ever since the New England Journal of Medicine article came out, kind of displaying really what that could do. And with ECHO, I sort of developed this concept of elimination, the power of that possibility. And I'm going to just first say that I'm adopting a new term, microelimination, because for me, it's less daunting to use that term. If we think about sort of the global initiative that's out there for hepatitis, and you hear much about it, it's kind of, it's big. Maybe too complex, too big when you talk global. But if I take my little corner of Northern California and talk about microelimination, then that seems much more doable to me, and much more doable when I've got ECHO to help support that. So in November of 2015, we launched ECHO at UCSF. And within the 12 to 18 months after we've launched, we managed to onboard 54 spokes, and we covered 21 counties in the state. We very quickly got the feedback that all of you are so familiar with about how much we were appreciated. We were getting comments from physicians who were saying they had really never felt they had support for their care of patients with hepatitis C, that they felt isolated, and that finally they felt that they had someone that they could reach out to help them with their complex patients. And those hubs those spokes inspired us to just keep reinventing our mode of education. So in addition to our biweekly Zoom conferences, we also added in a HCV 101, which we offered quarterly, where the spokes could come to UCSF for an immersion. It was kind of our fast track to become a HCV provider. We developed a warm line called HCV Voice, where they could reach us 24/7 if they had a question. We wanted always to provide our new treaters with a sense that they were cared for, that they had really wraparound support as they undertook the care of those HCV patients. So for a year and a half worth of work, I feel viewed from the outside that we have sort of initial evidence of success. And certainly we felt we had a decent start to our ECHO program. But I had the sense that it wasn't enough. That sense of urgency that I have just kept plaguing me, that we needed to expand more rapidly and we needed to expand into other areas. So if you look at that map, you'll see there's whole sections of Northern California in which we don't have HCV providers that are being able to provide care. And I knew the stats. In California, 14 out of the 15 Northern California counties have rates of HCV that are higher than state averages, and most of them are in rural communities. So there was huge need and very few providers. And so out of that great desire to find a solution for the rest of Northern California was born the idea of ECHO Plus. So ECHO Plus really builds on the shoulders of ECHO. The focus with Plus is to rapidly expand the number of treaters, to find individuals and create them within the communities that most need it. And we have two major strategies that we're going to use for that. One is that we've partnered with another large institution, UC Davis, which has an extensive telemedicine network that it's been utilizing for the last decade. Over 220 sites throughout Central and Northern California where they have consultants seeing patients. Well, we're going to take that model and turn it into telementoring, using not only specialist and patient, but specialist with patient and provider all at once, and loop those individuals back into ECHO once they've been initiated to the program. So that's our one way of rapidly expanding. The other aspect of ECHO Plus is that we feel that we really have to know our communities. And so for this, we've brought on a very special individual. I want to introduce you to Jennifer Schleppen. Jennifer is an RN. She's an HCV survivor. You'll see her there in the MR machine getting her liver scan done. She's been an activist since she had her cure. She's been on the road really bringing awareness to the diagnosis and really working within communities. And I am fortunate enough to have her partner with us to do ECHO Plus. She is our outreach liaison. So I want you to see the picture on the right, which shows her with her Airstream. She has CareStream, which I love, and the nurse is in, right? So Jennifer is going to go to these counties and put herself in the communities to get an understanding of what the dynamics are there. She is going to be our boots on the ground, as it were. She's going to be there to bring awareness regarding hepatitis C, both testing and the need for treatment, and ultimately it's to cultivate new providers in those areas. Remember that really we need to understand the local environment if we're going to be able to provide the kind of support for those providers that they need. And Jennifer has just started her journey in terms of being our outreach liaison. I'm just going to give you a little story just to give you a flavor of what it's going to look like. She told me she recently went up to Eureka. It's a small town, northeast California, 27,000 people. And she went into a convenience store, pick up a snack, and on the counter, she noted that there was a donation jar. And the note said that they were seeking donations for a woman who had overdosed, and they were seeking the donations for funeral expenses and for the care of her 2 children that remained. Jennifer reached down in her pocket, puts the change into the donation jar, and then turns to the person behind her, who's a 30-something-year-old, got the grunge look happening, lots of tattoos. But she sensed that he was just the right person to strike up a conversation with. And she turned to him and said, "Did you know her?" He replied, no, he didn't, but it did open the door. And Jennifer then went on to say why she was there, the importance of the mission. And he went on to share that he knew several individuals who had died of overdoses in their community over the last several years, including his brother, who was 18 years old. Jennifer asked him if his brother had been infected with hepatitis C. And he replied he didn't know. He'd probably never been tested. They went on to talk about many things, stigmatization, the barriers within the community. the cycle of drug use within their young population. But in the end, Jennifer said they left with a sense of hope that with her being there and with what was coming, that there would be some hope for that community. That's what we're going to have with Jennifer in place. And that's the other arm of ECHO Plus, is to understand our communities and really build awareness about hepatitis C, acknowledge the partnership that we're going to need in terms of managing substance use disorders, and really ultimately to find providers that we can cultivate to become our next HCV champions. Now, I'm often asked, why am I so charged up about microelimination? And it's really because I'm a clinician and I've been doing this disease for 20 years, and I've seen many, many patients who didn't make it. So I don't want another patient who's going to get liver cancer and who's going to die before we get to them. And I also know that really HCV cure is so transformative. This hangs in my office. It was given to me by a patient in 2005. That was when the treatment was actually quite hard and involved, and he was a success. And he created this for me, and I keep it in my office. It's like a constant reminder to me of why we do what we do and why elimination is so important. We need to cure individuals because it changes their lives. It allows them to move on and put Hep C finally behind them. It is truly transformative. So that is really the power that we have with ECHO, and ECHO Plus is to rapidly expand our care of patients through our building of capacity of HCV providers. So as we now have a lot of discussion about elimination, the WHO talks about it, many nations are now looking to do HCV elimination. And ECHO Plus are going to be seeking to do microelimination in Northern California. And in closing, I would ask you each to look in your own backyards, to think about microelimination there. If we're going to be successful at this global elimination agenda, we all need to be thinking about how we can eliminate hepatitis C in our clinics, in our counties, and in our country. Thank you.